Dear administrators and staff of Duke Regional Hospital, our mother was a Duke Health patient for nearly 6 months, with the majority of that time spent at Duke Regional. Due to COVID policy, the two of us were the only ones who could visit for most of the time, which meant that we were both there nearly every day for almost half a year. Between the two of us, we visited Regional hundreds of times and worked with hundreds of individuals, many of whom became regular fixtures of our day-to-day life. Those individuals were uniformly professional, kind, generous, courteous, compassionate, and sensitive. We wanted to take this opportunity to simply say thank you for your care, not just of her, but also of us. The very first line of contact we met at the hospital each day was probably the group that we got to know the best, the folks sitting at the front desk as we entered Regional. What a wonderful group of people. Kim, Kathy, Makisha, Crystal, and Debbie, behind the desk, along with Stephen and other security guards, always greeted us with a smile, a kind word, and sincere sympathy every time we walked in. It was not always easy for us to go to the hospital day after day, and it meant so much to know that when we got inside the door, we would be met with such kindness. The doctors and the other medical providers were equally amazing. Not once did we feel like Mom was getting anything less than the absolute best treatment available anywhere. And we saw providers from across the spectrum, doctors from the mental health team, general medicine doctors, epidemiologists, ECT specialists, immunologists, and cardiologists. And on top of that, speech therapists, physical therapists, physician's assistants, palliative care specialists, and many, many more were always so knowledgeable and responsive. She was helped by so many wonderful professionals. Dr. Curtis, Dr. Tetro, Dr. Feiger, Dr. Feigl, among many others. We expected world-class medical care from Duke. What we are particularly grateful for is the care and dignity with which they treated Mom and us. But most importantly, we want to send our undying gratitude to the incredible nursing team that served Mom from day one. We always knew that Mom was in the hands of someone who was truly looking out for her physical and emotional well-being. It meant the world. Generally, we would send gratitude to all the folks on the 8100 wing at Wayne Duke, the 4100 wing and critical care unit at Regional, and at the top of the list, the 5100 wing at Regional, where Mom spent most of her time. Specifically, we would thank Deborah, who would sit outside Mom's room to keep an eye on her, Sam, just the kindest person ever, Karen, an unbelievable pro, Rebecca, good luck Rebecca, Brian, Coco, Hunter, Lee, Nicole, and so many others. Obviously, this has not only been a hard period for us, we know that it's a difficult time for healthcare facilities and their workers everywhere. That just heightens our appreciation. Words can't express our gratitude, but with so many wonderful people to thank, it's the best we can do. Thank you all. And I thank you all. This has been an extraordinary 2 years, and I can't imagine having gone through it and serving with any other team. You are truly extraordinary, and this letter is really a tribute to you. It's a tribute to you, your care, your compassion. You are extraordinary, and I thank you from the bottom of my heart.